Hello, I am welcome, and we are live. Just going. Let's see. Just bringing on. Excited to have our conversation in just a little bit. To see some folks that are getting on and our guest speaker. This is great. All right. Awesome. Well, hello everyone, and thank you for joining us on Instagram Live for this conversation about flu vaccines and pregnancy. I'm Irene Ninge, Chief Science Officer for the Society for Women's Health Research. SWHR is a national nonprofit committed to promoting research on biological sex differences in disease and improving women's health through science, policy, and education. According to the CDC, influenza, also often known as flu, led to 26 million illnesses, about 300,000 hospitalizations, and up to 19,000 deaths in the United States during the last flu season. And for pregnant people who get the flu, even at optimal health, changes in the body during pregnancy can increase the risk for developing serious illness and pregnancy complications. So today, we are glad you are able to join us along with maternal fetal medicine specialist, Dr. Judette Louie, to hashtag SWHR Talks Vaccines, specifically the benefits of flu vaccine for women and their families with a focus on pregnant populations. Dr. Louie is the chair of, Dr. Louie is the chair of OBGYN department at the University of South Florida. And she has an extensive career focused on maternal morbidity and mortality. Though her work is as a clinical leader for the Florida Perinatal Quality Collaborative, Dr. Louie has led statewide programs to improve management of obstetric emergencies in the state of Florida. She's passionate about making pregnancy safer for all women, and in particular, improving maternal health across the lifespan. SWHR would like to thank CSL Seqirus for their support of our vaccine education programming. SWHR does maintain independence and editorial control of our program development, content, and work products. And Dr. Louie is not being compensated for her participation today, but is joining us in her personal capacity as an esteemed expert in the maternal health space. I'm going to bring her on. And let's see. All right. See if we got this going. Ah, there we go. Got it going. Welcome, Dr. Louie. How are you doing today?
I'm doing well, thank you. I made you wait to build suspense. I'm dramatic that way.
We love it. And so I guess, can you start off by explaining what is a maternal fetal medicine specialist?
Oh, glad to, because so many people do not know what it is. But when you think about the name high risk obstetrics, basically we specialize in high risk pregnancy. So we are individuals who completed a residency training in obstetrics and gynecology and decided that we wanted to, be the ones who really help usher moms through pregnancy safely to have better outcomes for their moms, for the moms and the babies. And so we specifically focus on high-risk pregnancies for both mom and baby.
Okay. And so, everyone has heard of the flu, and it's often thought of as not a big deal. But
Right.
For pregnant populations who get the flu, there are complications that we should be aware of. And so can you talk a bit about what those are?
Yeah. So basically, there's something about pregnancy that makes certain parts of your immune system a little too robust, and then other parts of the immune system not robust enough. And so if you are pregnant and you catch the flu, and like a lot of other viruses in pregnancy, you tend to have worse outcomes, that you're more likely to end up in the intensive care unit. You are more likely to end up intubated in the intensive care unit. You're also, unfortunately, more likely to die from the flu. And so a lot of people sort of assume the flu is no big deal, but if you're pregnant when you catch the flu, it can in fact turn into something that's life-threatening.
Wow. And so there's a survey in 2021-2022 flu season that the CDC reported a decrease in vaccine coverage in pregnant women by almost 54% from the previous flu season. And so we know vaccine hesitancy is real for a lot of individuals, with pregnant people reporting concerns about safety risks for the flu and other vaccines to the baby. What can you tell us about evidence of vaccine safety for those that are pregnant?
Well, especially for, vaccines like the flu that we have had for a long time, the technology is not new. It's very well established that it is safe in pregnancy, that unless you have an allergy to certain components, or that you've had a condition called Guillain-Barré, that it makes more sense to get the flu shot because of the protection that it provides from those really bad outcomes, and that it does so with it being very safe for the vast majority of people. And so when you look at risk and benefit, it's in favor of getting the flu shot if you are pregnant.
Okay. And so, you mentioned there's different ones, and let me say flu vaccines, because I know there's different types of flu vaccines. There's a live attenuated flu vaccine, which is a nasal spray, correct? And then there's also the recombinant, the inactivated, which is given as a shot, which I think most people are familiar with. In lay terms, what is the difference, or what should we be aware of when it comes to these different vaccines?
So In general, we do not give live vaccines in pregnancy because of the fact that you don't want to introduce, live virus because they're, although generally safe when you're not pregnant, when there's a baby involved, so at least that's the one category where we say we do not do that. We also know that some of the nasal vaccinations aren't as robustly effective. And so we do prefer, getting the usual one that we describe where you get a shot. And those have been demonstrated to be very effective in preventing pregnant patients from getting the flu and from getting severely sick from the flu.
Okay. And so during this time when you're pregnant, is there any blackout time where you're not supposed to get the flu vaccine? Is it okay? First trimester, second, third?
It is okay any trimester. And in fact, one of the things that we emphasize is to get it as soon as you can, so that you have that protection. Sometimes patients will say, oh, I'll get it later in, second trimester because they're nervous about miscarriage or for whatever reason, but we know that then that decreases the likelihood that you will ever get it. And so you will see that some offices where they have the capability, they even offer flu shots in the office just to increase the access that the patients have to it.
And, you're in this high-risk pregnancy phase as an FMF, as an MFM,
Yeah.
You work with a lot of high-risk pregnancies. And so what can you share about the primary concerns that your patients see when it comes to the flu vaccine that you might want to offer some ease for?
Yeah. I think it's always the same complaints, the same concerns, right? Often patients are, hearing what their family members are saying or what their friends are saying, and I think, safety is always the number one thing that people are concerned about. Second are the symptoms, and the concern that, you hear sometimes people will say, oh, I got my flu shot and then I caught the flu. So again, going back to the issue of safety, the technology is not new. It's been, well established year after year that the flu vaccine is safe for pregnant patients. It does not result in miscarriages or stillbirths. In fact, you are more likely to have some of those outcomes that you're scared of if you actually catch the flu itself, and particularly if you develop a severe version of it and end up in the intensive care unit and, end up, intubated. The second thing is, like I said, is symptoms. People worry about some of the symptoms that they may get after getting a flu shot. Most of the symptoms are just sort of local irritation, the pain from the shot. But overall, the flu vaccine is very well tolerated. And because we're not using, live components in the vaccine, you're not catching the flu from the vaccine itself.
Okay. And I know that's really, an important component because you hear that a lot. Like, oh, I got the vaccine and then I got sick, or I got, cold symptoms or something like that. So I know I'm about to be down for a couple of days. And so even speaking of protection, we're doing this to protect mom, to protect baby. How young can someone get the flu vaccine in general? It's 6 months, correct?
So,
normal.
Yeah. So yes, pediatric populations can get the flu vaccine. Although hopefully I don't have 6-month-olds who are pregnant. So
no. I mean, in general,
but yes,
protecting the whole family as well.
So. Yes, the whole family. 100% agree. Actually, you do bring up a good point, right? That sometimes what ends up happening with our pregnant patients is that the pregnant patient themselves may want to get the flu vaccine, but then the family members don't. And you do bring up a good point that, the best protection for that patient really is if the whole family who's eligible is getting vaccinated. And so sometimes you may have just one individual get vaccinated, and that's not complete protection. It's better than nothing, but it's not complete protection.
And so I'm assuming taking advantage of the flu vaccine during the season will help even after a baby is born to make sure that there's that additional protection in those months following, in those early stages, not just for mom, but like you said, the whole family.
Well, and especially as the baby is really vulnerable in the initial months that you bring them home. So, and then the other thing, for patients that are breastfeeding, and we love breastfeeding. There's so many benefits to it for those who can do it. That there are additional protections given to the baby, through breast milk, from the mom getting the virus and the mom getting the vaccine and developing antibodies to the virus that then you could pass on the antibodies in breast milk.
Okay, so it's a gift that keeps on giving,
It does.
right?
It does.
So, and pivoting a bit to some of the disparities we see when it comes to influenza.
Mm-hmm.
The flu vaccine coverage is consistently lower amongst Black, Hispanic, Native American, and Alaska Native populations and adults.
Mm-hmm.
What does this mean for those communities that do not have, that are not vaccinated?
You're right. The issue with this inequity is that it's not just one issue, right? It's not just that they're less likely to be vaccinated for a number of reasons that include things such as, the individual beliefs of not believing in getting vaccines. There are also systems issues where even if they wanted the vaccine, sometimes there's difficulty in access to the vaccine. Not all of the centers where you get your prenatal care will have vaccine availability. The good thing is that it now, with it being in a lot of pharmacies, that has improved access, but you also have to have, insurance coverage so that you can access the vaccine. There are some centers that may offer the vaccine for free, but again, you have to know about it, and so that information has to be disseminated, and then you have to have access. And when we're talking about these vulnerable populations, some of the issues that make lack of vaccination even more dire is that not only are they being left vulnerable by not being vaccinated, but also that, they are disproportionately more likely to be in situations where they are exposed to someone who has the flu, whether it's that they commute to work on public transportation, they are working in settings where, in industries where they're exposed to more people, and so therefore more likely to be exposed to someone who has an asymptomatic or a symptomatic infection. And at baseline, they may be in situations where they are disproportionately less likely to be able to call off from work. And so then they're more likely to keep going, even though really they need the rest to recover. Or they may be living in areas where there are food deserts, and so there's a lack of, proper nutrition. And so at baseline, they are starting in a place that is not as healthy and makes it harder to recover. So, it's not one thing in isolation, but that, all of these, factors, play together that then result in worse outcomes for the patient. And, and these are factors outside of the patient's control.
And I think that's, you touched on a lot of different factors that, again, there's resources, like you mentioned, availability, but then also access to those resources, and then the other factors of taking the steps to if you do have the availability and the access, making that decision, that informed decision, which is why we brought you on here today. We're hoping that sharing this information will provoke some change as far as those that might not have been sure, they had some questions, that they'd be able to get some more information. And so, when I will kind of close, of course, we don't want to be on here too long. IG, and thank you so much. But when's the best time to get the flu vaccine? Like, if I'm pregnant, summer, winter, or spring, I know there's a lot of talk about it now. What's the best time?
If you don't have it, get it now. I got mine. Typically, every year they look at the strains that are coming out and try to make sure They do the best they can to have a vaccine that reflects the strains of influenza that's out there. And typically it comes out late summer, early fall. So already you should have had your flu vaccine. If you didn't, please consider it, go out and get it. From my perspective, it's not about saying you have to get it. It's about making sure that you have the right information so you can make the right choices for you and your family. And that includes knowing, about the potential harm should you catch influenza while you're pregnant.
Okay, well, so, that means if you haven't gotten your flu vaccine, you should go get it as soon as you're able to. Dr. Lee, do you have any, final words of encouragement that you have for those that are watching?
Yes, we have tools that help you get to a healthy place at the end of pregnancy and then beyond. Please consider using them. And, like I said, the flu vaccine is one of them. Unfortunately, as a maternal fetal medicine physician, I have taken care of pregnant patients in the intensive care unit who caught the flu, and I can tell you almost all of the ones who end up in the ICU, and certainly the ones who have passed over my 20 plus career, all of the ones who have passed, none of them were vaccinated. And so it does drive home the point that, for something so preventable, you really should consider using the tool that is available to prevent it.
Thank you so much. And so all of everyone that's watching, you heard it right here. I'm Irina Ninier with Society for Women's Health Research and our special guest, Dr. Judette Louis, encouraging everyone to defend together. Yes, our conversation centered on pregnant populations, but everyone should take advantage of the flu vaccine to protect your health and the health of your loved ones this season and every year. SWHR invites you to keep the conversation going with hashtag SWHR Talks Vaccines. Thank you for joining us and have a good rest of your day. Thank you.
Thanks for having me.
Thank you.